Have you ever noticed your skin or eyes taking on a yellowish tint, or perhaps received a blood test result that left you wondering what it meant? It is your body sending you a message, a signal that something needs attention, much like a warning light on your car's dashboard. Elevated bilirubin readings, often a sign of jaundice, generally indicate an issue with how your body processes and eliminates this natural byproduct, most commonly pointing to a problem with your liver, gallbladder, or the rate at which your red blood cells are breaking down. It is a critical marker that helps your doctor understand what might be going on inside. To understand why bilirubin levels might rise, let us first look at what bilirubin is and its normal journey in your body. Bilirubin is a yellowish pigment that is created when old red blood cells are broken down. Hemoglobin, the protein in red blood cells that carries oxygen, is processed into an unconjugated form of bilirubin. This unconjugated bilirubin then travels through your bloodstream to your liver. Once in the liver, it undergoes a process called conjugation, where it is transformed into a conjugated form, making it water-soluble. This conjugated bilirubin is then excreted from your liver into your bile, which ultimately flows into your small intestine to aid in digestion and then leaves your body in your stool. Problems can arise at any stage of this journey. For example, if red blood cells are breaking down too quickly, such as in certain blood disorders like hemolytic anemia, the liver can become overwhelmed, leading to high levels of unconjugated bilirubin. Liver conditions like hepatitis, cirrhosis, or certain medications can impair the liver's ability to process bilirubin efficiently, resulting in elevated conjugated and unconjugated bilirubin. Furthermore, if the bile ducts are blocked by gallstones, tumors, or inflammation, conjugated bilirubin cannot exit the liver and backs up into the bloodstream. Even a harmless genetic condition called Gilbert syndrome can cause mildly elevated unconjugated bilirubin levels, often without significant health concerns. So, if your blood test shows an elevated bilirubin reading, what should you do? The most important step is to consult your doctor. They will look at the specific type of bilirubin that is elevated, whether it is unconjugated or conjugated, along with other liver function tests, to help narrow down the potential cause. Your doctor might order additional blood work or imaging studies, such as an ultrasound or a magnetic resonance imaging scan, to further investigate the root of the problem. Remember, elevated bilirubin is a symptom, not a diagnosis in itself, and requires medical evaluation to determine the underlying condition. Understanding the distinction between unconjugated, sometimes called indirect bilirubin, and conjugated or direct bilirubin, is a powerful diagnostic tool for healthcare professionals. When indirect bilirubin is primarily elevated, it often suggests issues occurring before the liver, like increased red blood cell destruction or certain genetic conditions. Conversely, a predominant elevation in direct bilirubin usually points to problems within the liver itself, such as liver disease or an obstruction in the bile ducts preventing its proper excretion. This precise differentiation guides doctors towards the correct area for further investigation, saving valuable time and ensuring a more targeted approach to your care. Ultimately, an elevated bilirubin reading is your body's way of alerting you and your doctor to an underlying issue that needs attention. By understanding the possible causes, from red blood cell breakdown to liver dysfunction or bile duct blockages, you are better equipped to discuss your test results with your healthcare provider. This proactive approach ensures that any potential health concerns are identified and addressed promptly, supporting your overall well-being and helping you maintain optimal pancreatic and liver health.